Good evening, and thank you for joining me. I'm Dr. David Thompson, and for the last 3 decades, I've had the privilege of watching miracles unfold in my clinic. Miracles that started not with a prescription, but with a fork. Let me tell you about a patient of mine, Mrs. Eleanor Vance. She was 72 years old, living just outside of Tucson, Arizona. When she first came to me 2 years ago, her life had been reduced to the 4 walls of her living room. Her knees, both of them, were shot. Years of waitressing, followed by the sedentary life of an office accountant, had left her cartilage so thin, the X-rays looked like bone grinding on bone. Her specialist had given her the grim prognosis, a double knee replacement, followed by months of painful rehab, and frankly, a strong suggestion to start planning for assisted living. Can you imagine the fear? The crushing dependence? Eleanor, a woman who had always been fiercely independent, was heartbroken. She couldn't walk her dog, couldn't tend her beloved cactus garden, and she was truly on the verge of entering a nursing home. Her life, as she knew it, was over. But here is the miraculous result today. Just 3 months ago, I received a postcard from Eleanor. She was hiking, yes, hiking, the trails of the Grand Canyon. She described her knees as feeling 30 years younger. No walker, no cane, and certainly no nursing home. She's healthy, independent, and vibrant. What was the solution? It wasn't a $1 million pharmaceutical drug. It wasn't a risky surgery. It was a simple, natural method, a targeted food protocol that 97% of mainstream doctors usually overlook because they're trained to treat symptoms, not the root cause. They focus on pain management. We focus on cellular regeneration. Today, I'm going to guide you through the detailed implementation of Eleanor's secret. We're going to dive deep into 5 specific, powerful foods that don't just mask the pain, but actively provide the structural compounds your body needs to rebuild worn knee cartilage from the inside out. This is your path to regaining independence. Stay with me, because what I'm about to share could fundamentally change the rest of your life. Before we begin this journey, I need to know who I'm talking to. I want to build a community here that heals together. Please, I ask you to take 10 seconds right now and immediately comment your current main symptom. Is it the cracking sound in your knee? The stiffness when you first get out of bed? The dull, persistent ache? And comment your current age. Just type symptom and age below. This helps us see the scope of the problem and support one another. Now, let me be very clear. What you are experiencing is not an inevitable result of your genetics or simply getting older. That is a dangerous, lazy medical myth. The degradation of your joint cartilage is due to a chronic, long-term deficiency in just 3 specific nutrient classes: structural precursors, antioxidants, and anti-inflammatory lipids. Your body is constantly trying to repair itself, but you're not giving it the essential building blocks or the protective defense mechanisms it needs. It's like trying to build a brick wall without enough cement, and while a sandstorm is raging. We're going to fix that, naturally. For those of you who are new here, my name is Dr. David Thompson. I'm a physician who trained at a very traditional institution, but quickly realized that the power of healing often lies outside the pharmacy. For over 30 years, I've dedicated my practice to treating thousands of patients with science-backed, personalized nutrition. This channel, our mission, is simple. We help good people like you live healthy, independent lives well into their 80s and 90s, free from the burdens of chronic disease and pharmaceutical dependency. We do this by focusing on scientific nutrition, the biochemical proof of how food talks to your genes and rebuilds your cells. I'm not here to sell you a supplement or a book. My only job today is to transfer 3 decades of clinical success directly to your kitchen. I've seen the pain, the fear, and the shame associated with joint mobility issues, and I promise you, there is hope, and it starts now. Let's do a quick self-assessment. Cartilage breakdown is rarely an isolated problem. It's part of a systemic issue. I want you to mentally check off how many of these 5 common, everyday symptoms you are experiencing right now. 1. Morning stiffness. Do your joints feel stiff or locked for more than 30 minutes after waking up? 2. The weather vane effect. Do your knees ache or throb right before a change in the weather, particularly cold or rain? 3. Low back or neck tension. Do you constantly feel a tight knot in your lower back or the base of your neck that just won't relax, even after stretching? 4. Brain fog or mid-afternoon slump. Do you experience a noticeable drop in mental clarity or energy between 2 p.m. and 4 p.m., where you struggle to focus? 5. Difficulty climbing/descending stairs. Is there a noticeable, sharp pain or a feeling of instability when going up or down just one flight of stairs? Okay. How many did you check off? Comment the number below. 1, 3, or 5. The more symptoms you checked, the stronger the evidence that you are suffering from the underlying silent root cause of all joint degeneration, a deadly triad of ischemia, oxidative stress, and chronic inflammation. Chronic inflammation. This is the body's overzealous immune response that doesn't shut off. It releases destructive enzymes that literally digest your cartilage matrix. Oxidative stress. Think of this as rust on a car. Free radicals attack and damage the building blocks of your joint tissue. Ischemia. This is the most crucial part. Cartilage has no direct blood supply. It gets nutrients from the synovial fluid, but if the surrounding joint tissue is inflamed and tight, this nutrient exchange is starved. This is a lack of circulation, leading to a kind of cellular suffocation. The 5 foods we are about to discuss are specifically chosen because they target and dismantle this triad, allowing true, organic cartilage regeneration to begin. Solution 1. The surprising green powder. Our first powerful food is a humble green powder you probably already have in your spice cabinet: turmeric. Specifically, its active compound, curcumin. This might not be surprising, but how you consume it is the key that 99% of people get wrong. I want to tell you about Mark, a 55-year-old office worker from Chicago. He had what we call desk jockey knees, constant, dull ache, and significant swelling after sitting for too long. He was taking 800 milligrams of ibuprofen daily. After incorporating this specific turmeric protocol, Mark reported that his knee swelling was visibly reduced within 10 days. His stiffness was so diminished that after 6 weeks, he was able to play 18 holes of golf, pain-free, for the first time in 5 years. Curcumin works at the molecular level like a sophisticated cellular emergency brake. The central issue in knee breakdown is chronic inflammation, driven by molecular pathways like NF-κB, nuclear factor kappa light chain enhancer of activated B cells. NF-κB is the switch that turns on the genes responsible for producing pro-inflammatory cytokines, like IL-6 and TNF-alpha, which destroy cartilage. Curcumin directly inhibits the NF-κB pathway. By blocking this switch, it slows the production of the destructive enzymes, giving the cartilage cells, the chondrocyte, a chance to live and regenerate. A meta-analysis published in the Journal of Medicinal Food in 2016 examined the effects of curcumin on arthritis. The study concluded that curcumin extract was comparable to ibuprofen in reducing pain and improving function in patients with knee osteoarthritis, but without the gastrointestinal side effects. It's a natural anti-inflammatory agent with structural benefits. Practical guide: how to. Dosage: start with a half teaspoon of high-quality organic turmeric powder daily. Golden time: evening. Anti-inflammatory compounds work best overnight as the body is in repair mode. The key combination: curcumin is fat-soluble and poorly absorbed. You must combine it with a source of fat, like a teaspoon of coconut oil or olive oil, and a pinch of black pepper, which contains piperine, enhancing absorption by up to 2,000%. Recipe: the golden paste. Mix a half TSP turmeric, 1/4 TSP black pepper, and 1 teaspoon coconut oil into a small cup of warm plant-based milk, almond, soy. Sip slowly before bed. What to avoid: heating it aggressively or mixing it with highly processed sugars. Have you ever made the golden paste before? If not, Does the idea of replacing a pill with a simple kitchen spice give you hope? Let me know in the comments. Solution 2. The controversial tropical fruit. Our second food is a controversial tropical fruit, mainly due to its high sugar content when processed, but in its whole, fresh form, it's a joint superhero, pineapple. Meet Sarah, a 35-year-old postpartum mom. Her joints were loose, aching, and inflamed, a common scenario due to hormone changes and the new physical demands of motherhood. She was skeptical, but started having this pineapple preparation. Within 3 weeks, she noticed she could squat and lift her baby without the severe, sharp knee pain she was used to. The key was a specific enzyme this fruit contains. The magic lies in bromelain, a potent enzyme mixture found most concentrated in the core/stem of the pineapple, the part most people throw away. Bromelain is a proteolytic enzyme, meaning it breaks down proteins. When taken on an empty stomach, crucial, it acts systemically as a biofilter. It helps break down circulating immune complexes, large protein clumps, that circulate in the blood and get trapped in the joint capsule, fueling inflammation. It clears the joint environment, reducing swelling, and creating space for the crucial synovial fluid to flow and nourish the starved cartilage. This directly fights the chronic inflammation part of our destructive triad. The journal Arthritis Research and Therapy published a review in 2004 highlighting bromelain's therapeutic effects. Studies demonstrated that it significantly reduced pain and joint stiffness in patients with mild to moderate knee pain, confirming its anti-inflammatory and analgesic properties, often rivaling NSAIDs. Practical Guide: How to. Dosage: 1 cup of fresh, raw pineapple, with an emphasis on the fibrous core. Golden time: morning, on an empty stomach, or between meals. Taking it with food neutralizes its systemic enzyme effect, as it will just digest the food. Recipe: the core smoothie. Use 1 cup of chunked pineapple, ensuring you include a generous portion of the harder central core. Blend with water or a low-sugar liquid. Notes: must be fresh. Canned pineapple is heat-treated, which destroys the enzyme. What to avoid: consuming this immediately after a high-protein meal. Are you guilty of throwing away the core? Now you know that's where the best medicine is. Give me a tropical fruit in the comments if you'll start saving the core. Solution 3. The forgotten ancient spice. Our third solution is an ingredient that has been used medicinally for thousands of years, primarily as a coagulant, gelatin or collagen peptides. This is the purest form of structural precursors you can ingest. Consider Brenda, a 68-year-old retired teacher from Seattle. She was dealing with deep, grinding pain. Her cartilage was not just worn, it was severely fragmented. We introduced a specific regimen of high-quality, pure collagen. After just 1 month, her orthopedic surgeon noted a visible, slight improvement in her knee joint space on the follow-up X-ray. She attributed her ability to walk her grandchildren to the daily bone broth. Cartilage is primarily made of water and a matrix of type 2 collagen. When you ingest high-quality hydrolyzed collagen peptides, your body breaks them down into specific amino acid sequences, peptides, that act as a direct cellular signal. When these peptides reach the joint, they don't just become part of the cartilage. They signal the chondrocyte, the cartilage-building cells, to ramp up their own production of type 2 collagen and proteoglycans, like hyaluronic acid. It's not just a building block, it's an instruction manual. This directly feeds the structural precursors deficiency. A clinical trial published in Current Medical Research and Opinion in 2006 studied athletes with functional knee pain. The study demonstrated that the ingestion of collagen hydrolysate reduced joint pain in this population and suggested it could support the regeneration of the cartilage matrix. This shows its restorative, not just palliative, effect. Practical Guide: How to. Dosage: 10 to 15 grams of hydrolyzed collagen peptides, must be hydrolyzed for maximal absorption. Golden time: morning, mixed into your coffee, tea, or water. It's easily digested and primes your body for repair early in the day. Recipe: the Neutral Booster. Add 1 to 2 scoops of unflavored collagen peptides to your morning beverage. It dissolves easily and is virtually tasteless. Notes: if you prefer food, slow cooking bone broth for over 12 hours extracts significant gelatin/collagen. What to avoid: cheap collagen from non-grass-fed or non-marine sources. Purity matters for the peptide signaling. Do you currently take collagen? If so, what difference have you noticed? Share your experience below. Your story could be the encouragement someone else needs. Solution 4. The Essential Ocean Gem. Our fourth powerhouse food takes us back to the sea, but not for fish meat. We are after a specific, tiny, cold-water fish, rich in the ultimate anti-inflammatory molecule, wild-caught sardines, or salmon/mackerel. The key is the omega-3 fatty acid, EPA and DHA. Remember Eleanor, the woman from the opening story who avoided the nursing home? Her diet was almost devoid of proper omega-3s. Once she started consuming a small, daily portion of fatty fish, her knee warmth and nighttime ache, classic signs of inflammation, began to vanish within 2 weeks. Her mobility quickly followed. The magic is in the molecule's metabolism. Omega-3s, particularly eicosapentaenoic acid, EPA, and eicosahexaenoic acid, DHA, are precursors to a whole class of ultra-powerful local anti-inflammatory molecules called resolvins and protectins. Their name says it all. They resolve inflammation and protect tissue. They act like a cellular cleanup crew, actively shutting down the inflammation cascade and literally clearing out the inflammatory debris left behind. They interrupt the destructive cycle of chronic inflammation driven by the omega-6 fats prevalent in the Western diet. This is a targeted attack on chronic inflammation. A review in the Annals of the Rheumatic Diseases in 2014 concluded that omega-3 fatty acids significantly reduced the symptoms of osteoarthritis, noting that the incorporation of EPA and DHA into joint tissue could decrease the production of inflammatory mediators, thus slowing the progression of cartilage degradation. Practical guide: how to. Dosage: aim for 2 to 4 servings of fatty fish, sardines, salmon, mackerel, per week. If using a supplement, look for one providing at least 1,000 milligrams combined EPA/DHA. Golden time: noon/lunch. Consuming with other foods aids absorption of this essential fat. Recipe: the sardine snack. A small can of wild-caught sardines, packed in olive oil, drained, mixed with a squeeze of lemon juice. It's affordable and delivers maximum benefits with minimal mercury risk. Notes: look for wild-caught, small fish for lower toxin levels. Vegetarian/vegan? High-quality algal oil is your alternative source of DHA. What to avoid: farm-raised fish, which often have a poor omega-3 to omega-6 ratio. I know sardines can be polarizing. If you can't eat them, which other fatty fish do you prefer? Let's share tips on making these healthy fats palatable. Solution 5. The Humbling Root Vegetable. Our final, highly effective joint rebuilder is a root vegetable known for its vibrant color: beetroot. This is our final piece, focused entirely on the often ignored component of ischemia, lack of circulation. James, a 52-year-old high-stress executive, had very tight, painful knees, a classic sign of restricted blood flow. His pain was always worse after long meetings. He started drinking a specific beet juice shot. After 2 weeks, he noted that the tightness was gone, and his joints felt lubricated. He could sit and stand with far less discomfort. Beetroot is incredibly rich in dietary nitrates. When you consume them, your body converts them into nitric oxide, NO. Nitric oxide is a powerful vasodilator. It signals the smooth muscles in your artery walls to relax and widen. Think of it as opening up a constricted garden hose. This improved circulation means more blood flow to the joint capsule, ensuring that the precious nutrients from the other 4 foods, curcumin, collagen, bromelain, and omega-3s, can actually get delivered to the starved cartilage cells. It overcomes the ischemia problem, making all the other foods work better. A study in the Journal of Applied Physiology in 2013 confirmed that nitrate-rich beetroot juice intake significantly reduces oxygen cost and improves blood flow during exercise. While focused on performance, the mechanism of powerful vasodilation is what we leverage to flood the joint area with healing nutrients and oxygen. Practical guide: how to. Dosage: 1 small 4-ounce shot of fresh beet juice. Golden time: morning, 30 minutes before your first meal. This maximizes the vasodilation effect early in the day when your joints are the stiffest. Recipe: the NO shot. Blend 1 medium raw beet, peeled, with 1 small green apple and a squeeze of lemon. Filter and drink immediately. Notes: beet greens are also highly nutritious. Don't throw them away. What to avoid: using beets that have been aggressively cooked or canned, as heat degrades the active compounds. How many of you regularly use beets in your diet? If you felt the energy surge from a beet shot, comment "pumped" below. We have covered the 5 powerful foods that target the 3 enemies of your joints: chronic inflammation, oxidative stress, and ischemia. Remember, this is a healing process, not an instant fix. Consistency is your greatest medicine. This is about commitment to cellular health. Be patient with your body. It took decades to wear down that cartilage, and it will take weeks and months of dedication to rebuild it. I urge you to start with just one of these foods today, and slowly build the protocol. My gentle warning is this: do not stop taking any prescribed medication without consulting your primary physician. This is complementary care, not a replacement for medical supervision. Use this knowledge to empower yourself. If this video has given you a sense of hope and a pathway to independence, please do 2 things for me. 1. Hit the like button to help this vital, natural information reach more people who are suffering in silence. 2. Subscribe to this channel. Click the notification bell so you don't miss our next video, where I will reveal the single worst breakfast food that secretly destroys your joint cartilage. Thank you for trusting me with your health. Take control of your independence. You deserve a life free from pain. I'm Dr. David Thompson, and I look forward to seeing your success story in the comments. Be well.